Good afternoon and welcome to Open Classroom. I'm Janet Gillow, Director of Professional Development for the Brown School at Washington University in St. Louis. So happy to have you with us today. Throughout this webinar, our participants are muted. We cannot see or hear you, but we definitely want to hear from you. So the chat feature is enabled. You can send messages in, greetings, questions, comments, either just to the panel or to the panel and all participants, in which case everybody on the webinar could see the comment. Open Classroom, since we started it 6, 7, 8 now months ago, has been really about connecting our community to learn. And it's also provided an opportunity to practice some skills to improve our well-being, as all of us find ourselves in some challenging situations, and some more so than others. So the series we're kicking off today is really an offering of love to the health and public health workers who find themselves on the front line of the pandemic, and hoping that some of the techniques that are offered will be helpful to you. Before we get started today, I want to introduce my co-host, Assistant Dean Angela Hobson with the Public Health Master's Program here at the Brown School, for some introductory comments.
Great. Thank you so much, Janet, and thank you, Megan, for being here. Like Janet said, my name is Angela Hobson, and I am the Assistant Dean for Public Health at the Brown School and also a faculty member. So in addition to my privilege to teaching our master's degree students in epidemiology and environmental health, I have a major role in the administration of our master's degree in public health. And I think at the Brown School, we all know how much our work has changed since March, and we can only imagine the added stress and workload for all of you in health and public health practice out there. So, you know, we understand the critical importance of health and public health professionals and the work that we do, not only during the time of a pandemic, but in every day. And we really appreciate all the work that you're engaged in out in the community to improve health outcomes for all members of our community. So on behalf of the MPH program at the Brown School, we just wanted to extend a very mighty thank you for all the work that you do, and just say that we recognize the stress that a pandemic can cause, and hoping that you can get some great tips from this. I was just saying before we started that I'm really hoping to get some good coping and relaxation tips from this as well. So I'm really excited for Megan to be here with us. And I also know that we have some of our field instructors, some of our alumni, and some current students here joining us today. And I just want to give all of you a special thank you and shout out for being here too. And we really appreciate how engaged you are with us, and just really appreciate the work that you're doing out there to support our students and to support public health in general. So thank you so much.
Great. So my great honor and privilege to introduce our speaker. Dr. Megan Keys is a clinical psychologist who specializes in the assessment and evidence-based treatment of PTSD. She has over 20 years experience in the trauma field. Dr. Keys is adjunct faculty at the Brown School. She's also the founder of Trauma Empowered Consulting, which provides education and consultation services to professionals working with trauma survivors. So here to lead us through the first of our 3-part series, Adaptive Coping and Relaxation Skills for Health and Public Health Workers, please welcome my friend, Dr. Megan Keys.
Oh, thank you, Janet. And just to echo, I want to pop up the slides right now so everybody has them. Just to echo what both Janet and Angela said, you know, our hope is that this webinar series will provide some level of support to the health and public health professionals helping our communities navigate this pandemic. For those who are not health professionals, we certainly hope this will be helpful to you as well. Our primary focus during this series will be learning techniques for reducing pandemic-related stress, as well as enhancing emotional well-being. There we go. Okay, these are the topics that we'll be covering today. They're outlined here. These webinars are going to be composed of 2 key components. The first part is going to be mostly didactic and focus on a specific set of adaptive coping skills. In the second part, we'll introduce a relaxation technique, and everyone will have the opportunity to practice in a guided exercise if desired. We'll also be utilizing polling questions and the chat function for discussion and to address questions. So research on the mental health impact of COVID-19 has evidence that most people have been affected in some manner. A recent survey by the American Psychological Association indicated that close to 80% of the adults surveyed noted they still experience significant stress related to the pandemic, and close to 70% noted that their stress has increased over the course of the pandemic since it started. The majority of studies regarding the mental health impact for health professionals have been conducted on frontline healthcare workers, typically doctors and nurses, in hospital settings. Research has indicated that some of the key stressors our healthcare workers are experiencing include fear of infection for themselves and loved ones, excessive workloads with little opportunity for rest, rapidly changing work protocols, equipment-related issues, and simply providing care for much more severely ill patients. The most common mental health changes reported by healthcare workers have included just an increase in general distress, as well as symptoms of anxiety, depression, and insomnia. So the 3 sets of adaptive coping skills we'll be focused on in this series are going to address those issues. Today, we'll look at guidelines for reducing stress to help target some potential symptoms of anxiety. Next week, we're going to focus on sleep skills to help reduce difficulties and increased overall sleep quality. And our final week, we'll look at some helpful ways to adapt to the various losses that most everyone has experienced in some manner since the onset of COVID-19. When considering adaptive ways to cope with stress, it's really helpful to understand how stress impacts us in the moment, as well as over time. When we experience stress, even just thinking about something stressful, our brain interprets that stress as a sign of danger and immediately sends a signal to our body that we need to be ready to respond. This sets in motion a series of physiological changes: increased heart rate and blood pressure, rapid and shallow breathing, muscle tension, and the release of adrenaline. This process is called the stress response or fight or flight response. This automatic response is useful because it helps you react quickly when there's an imminent threat, such as someone swerving into your lane when you're driving down the highway. However, this response gets activated anytime we experience stress, even if no imminent threat is present. When you experience chronic stress, ongoing stress over a sustained period of time, this stress response is activated much more frequently, and that frequent increased physiological arousal can have a negative impact on both mental and physical health. So given COVID-19 would certainly be considered an ongoing chronic stressor, it can be really helpful to learn how to reduce some of that physiological arousal. And that's why we'll also be focused on relaxation skills in this series. Today, we're going to just start with a brief basic breathing technique, and then we're going to build on that skill in the weeks to come. Okay, so we can go ahead and segue into our first set of adaptive coping skills. So we're going to focus on these 4 strategies for reducing stress that may be particularly resonant in the context of the current pandemic. Just please note that none of the guidelines or techniques offered are intended to substitute formal or professional mental health treatment, so should such care be warranted. These really are being offered in terms of kind of information, self-help tools for your own use. However, I will also touch on some suggestions for seeking professional assistance as well when we get a little further into the presentation. All right. So research has shown that during times of national or global crisis, mass violence, natural disaster, excessive media exposure about that crisis, several hours or more per day, can increase feelings of distress. More recent research has demonstrated that excessive exposure to social media may actually exacerbate anxiety more than traditional media sources. So, for example, after the Boston marathons, a study evidenced that the individuals with the most symptoms of acute stress were the ones that had the most media exposure. even when compared to individuals who were at the site of the bombing when it occurred. And this finding just highlights the degree to which a lot of media exposure around these types of stressful life events really can potentially have a negative impact on your mental health. So given the amount of media exposure that COVID-19 receives, it may be helpful just to have a plan in terms of how you're going to approach viewing that media. So first, it's suggested just to identify and consistently obtain information from one or two reliable sources. Research tells us that when information is clearly conveyed from authoritative sources, people learn and benefit from it. You might want to consider setting some parameters around how frequently you're going to view those sources. For example, you may decide that you want to view those particular sites or channels in 15-minute intervals 3 or 4 times throughout the day. Once you're informed, consider stopping at that point. That sort of constant reading of recurring stories and media exposure about the same issue can have a tendency to exacerbate stress or anxiety. The key to this is really finding what balance is going to work best for you. You definitely want to stay and watch enough media exposure to stay informed, because research tells us that during events like this, that helps enhance our sense of safety and control. But you want to limit too much exposure so that it doesn't exacerbate your stress and anxiety. Research tells us that strong social support can enhance resilience to stress. However, in the context of the current pandemic, due to safety measures and various restrictions, social interactions have become a lot more limited, and many are reporting a sense of lost closeness with their family and friends and community due to this. So just some tips for enhancing social connection within the context of our current pandemic. First and most important is simply try to connect with others on a consistent basis, even if the only option is virtual, whether it be phone, text, video, social media, virtual online gatherings. Use whatever means you have at hand to try to maintain that kind of regular interpersonal engagement and connection with others. Extend invitations for people to connect, but be strategic. Social interactions are a lot harder to come by these days. So we definitely want to try to connect with people that we think can kind of give us what we need in that moment. So whether it's the family member that's the great listener, the friend who always makes you laugh, the colleague that you can vent to if needed, be strategic in how you seek those social connections. Consider sharing negative experiences with trusted family, friends, or colleagues. People need to talk to people, especially when experiencing significantly negative events. Research tells us that when people tend to avoid talking about those things and keep those feelings bottled up, it can lead to more negative health outcomes down the line. And finally, consider offering and providing support for others. Research tells us that giving support decreases negative emotions and increases positive emotions. That recent survey by the American Psychological Association indicated that most adults felt they could have used more emotional support over the past year. And finally, this also can help keep relationships a bit more balanced. You may be more willing to reach out for support from a friend that you recently supported, or vice versa. Our thoughts and perceptions of any given situation have a huge impact on our feelings. Given the various changes that are associated with this pandemic, it's understandable that many people may be experiencing feelings of anxiety and sadness and anger. These are normal, natural emotional reactions to these incredibly difficult circumstances. However, the intensity of our feelings can sometimes be exacerbated by our thoughts. If you notice at times certain emotions feel very powerful, overwhelming, maybe even disruptive to what you're doing, that can be an indication to check in on your thinking. We all have an inner dialogue. It's that steady stream of unspoken thoughts running through our head at any point in time. These thoughts or self-talk can be helpful or unhelpful. When our self-talk gravitates towards extremes or absolutes, using words such as never, always, should, that tends to be unhelpful because extreme thoughts often result in extreme emotions. Finding a way to replace some of those unhelpful thoughts with thinking that is just a little more balanced and a little more accurate not only helps reduce the intensity of those negative emotions, but it allows for the possibility of some positive emotions as well. So just for a few examples, one really common unhelpful thought that many may have experienced during this pandemic is, I have no control over anything, which understandably could result in feeling scared or helpless. Just shifting that thought slightly to something that's a little more accurate, I can control some things and I'm going to focus on those, not only likely will reduce the intensity of any of those negative emotions, but allow for some positive feelings as well, such as potentially feeling a bit more capable or feeling a bit more hopeful. Another really common unhelpful thought, especially in times with chronic stressors like the pandemic, is the thought, I should be coping better, which again, understandably, could certainly result in people feeling discouraged, feeling inadequate. Shifting that thought to something a little more balanced, most people are struggling and I'm doing the best I can, could also allow for the possibility of some more positive feelings, such as self-acceptance or a sense of reassurance that you really are doing all that you can for yourself. This link at the bottom of the page is provided by the National Center for PTSD, and it offers a great worksheet that walks you through several other types of uncommon, unhelpful thoughts folks may have during a significant stressor like this, and gives you some ideas on how to shift them or reframe them. All right. So resilience is defined as the process of adapting well to difficult situations. Resilience isn't a trait that people are born with or without. Resilience is a set of skills that can be learned and strengthened based on our choices, behaviors, and ways of thinking. Choosing to engage in adaptive behaviors while you're struggling and experiencing stress is resilience. And cultivating resilience is important because it serves as a protective factor against anxiety and depression, and it also improves our coping skills. So 2 key ways to increase resilience are building connections and healthy thinking, both of which we've already touched on. So I just want to expand on a few more. With regards to practicing wellness, for a lot of health and public health professionals, there can be a very strong sense of service to others that may make it difficult to identify and address your own needs. Prioritizing self-care is incredibly important, especially in the context of significant stress. Those basics, good nutrition, adequate sleep, regular exercise, help maintain good physical health, but also help protect against the negative impact of chronic stress. Some activities that can really help support good mental health include engaging in hobbies and recreation. Research indicates that people who regularly engage in enjoyable activities report lower levels of stress and enhanced positive mood. Actively trying to cope with stress or anxiety using adaptive skills, relaxation skills, yoga, meditation, mindfulness, these all strengthen resilience as well. In terms of learning from experience, when dealing with adversity, considering how you successfully coped with difficult situations in the past can be useful. Who or what was helpful to you? What did you rely on the most in order to continue moving forward? Considering using this information and your personal strengths as a guide for navigating current difficulties. With regards to finding meaning, maintaining a sense of purpose is very important. In the context of the current pandemic, many activities that were meaningful may not be feasible at the moment due to various restrictions. So one suggestion for trying to find a sense of purpose within this new reality is being proactive when helping yourself. Try to address problems or obstacles head on by breaking them down into more manageable steps versus avoiding them or letting them build up. Set realistic goals, even if they're small, that help you move in the direction of what you want to achieve. Goals may look very different during these times, but successfully navigating challenges and executing tasks can still provide a sense of accomplishment. And finally, remaining hopeful. It can be very difficult to be positive during difficult times. However, trying to remain hopeful or optimistic can be reassuring because it maintains that expectation that things are going to improve and get better eventually. And finally, part of adaptive coping involves recognizing when professional assistance may be needed, which often raises the question of how do I know? So I just want to outline a few potential indicators to keep in mind regarding whatever changes or symptoms you may experience. If any of these changes have become excessive, they're now occurring more often than not for an extended period of time. It's no longer an issue of just a bad day or a bad night. If these changes become distressing, so they feel unmanageable or out of control, maybe they've become a primary area of concern or worry for you. If these changes are compromising your relationships in terms of there's now a lot of interpersonal conflicts around these changes or symptoms, and if these changes or symptoms are impairing your functioning, which just basically means that these things are now getting in the way of you doing what you want to do or need to do. And then finally, safety concerns. If part of the changes as a result of all the stress is starting to have thoughts of hurting yourself or hurting others, maybe having much more frequent thoughts of death or dying, sometimes even having vague kind of better off dead feelings. These are all indications that professional assistance may be helpful, at least for an evaluation to try to determine what's going on. With regards to treatment, especially if you're considering psychotherapy, just please be aware there are many time-limited evidence-based therapies available for a range of issues, including depression and anxiety and insomnia. If searching for a therapist, this resource by Psychology Today is very helpful. It allows you to it allows you to search for a range of mental health clinicians based on the type of provider and your location. So it is not limited to psychologists. You can also search for clinical social workers, marriage and family counselors, and psychiatrists. And finally, I always want to ensure that people have a crisis line available if needed. The National Suicide Prevention Lifeline is a 24/7 confidential resource that is there to assist individuals in crisis, individuals with a loved one in crisis, and professionals working with people in crisis. So this resource provides a wide range of resources for people, and they have a lot of things outlined on their website as well. I would encourage you to consider adding that Lifeline phone number and website to the contact list in your phone, just to ensure that it's at your fingertips should you ever want or need it for yourself or someone else. Okay, so this is a list of mental health resources for the general public, but these sites all include links for special populations. So healthcare and frontline workers, parents, caregivers, etc. These resources are specifically geared towards health professionals. If we have anyone in administration or leadership viewing this, that third resource from the Uniformed Services University offers a lot of guidelines and resources for supporting staff or personnel. Okay, and that concludes our adaptive coping skills section for today. I do want to check in with everyone regarding kind of what was most resonant for you. So Janet is going to deploy our first polling question. And mostly I'm just curious, based on what you learned today, what kind of appeals to you the most if you were going to try out any of these stress reduction strategies? And I just want to base this on people's individual circumstances, current stressors, and whatever skills you're already using. So while we're waiting for that to tally, we can definitely use about the next 10 minutes to address questions that folks may have about any of the material that we've covered so far. There we go. Okay, so it looks like the social media and the unhealthy thinking are probably two of the biggest culprits right now in terms of what may be contributing to folks' stress. And then I also see a lot for the maintaining social. Okay, great. Thank you everybody for participating. It's just always good to see kind of what lands where. All right, and like I said, if anybody has any questions, you can certainly type them into the chat box and Janet and Angela can offer them up.
So we'll give people just a few more seconds to post any questions about the lecture portion so far before we move together into the practice.
Yeah.
Okay, well, there'll be time for more Q&A later, so I think let's keep going.
Yeah, absolutely. And we will circle back with another open session at the end for questions. So if folks think of them by then, we can certainly address them then. All right.
So of course, as soon as we say that, we do have a question coming in
of course.
From Dan. I'm just asking about common self-care activities that people are finding effective that are possible nowadays. So I guess just getting a little bit more specific about when we're saying prioritize self-care, make time for self-care, making that more specific.
And also for folks, feel free to contribute in the chat as well as in terms of what's working for you or what you found to be helpful. I think the most important thing to remember with self-care is really about engaging in things that are kind of good for you, mentally, physically, spiritually, emotionally. So it can be a very wide range. It's not always just the good diet and exercise and try to minimize stress. This is where it can become highly, highly individualized based on what you know works for you and is helpful to you.
So we are getting a few suggestions. Mine is definitely running outdoors every time that I can. That helps. But folks are suggesting coloring, connecting to nature, daily exercise, brewing and drinking loose leaf tea. Yeah, lots of people are fans of outdoor exercise. Other folks mentioning mobile technology apps that encourage calm and breathing, journaling to brainstorm self-care ideas. I love it when the audience chips in and gives each other ideas. That's when you feel we're still a supportive community.
Yes.
Funny shows and movies. Try something new. That's hard and great. Planting flowers in Animal Crossing. Okay, anybody else want to weigh in with what they're doing? Cooking? Woodworking. You can have a lot of frustration with a miter saw. I believe that's true. Taking a walk. Hand sewing. Start sitting in holiday decorated living room.
Oh, that's a good one.
Hygge. Baking new recipes, playing the piano. Drawing with chalk, playing piano, baking cookies. We have a new ukulele player in the group. Coloring books. Researching genealogy, painting, cleaning, baths, Netflix, yoga, mindfulness.
Excellent.
What a great list.
Yeah, thank you.
Old photos with kids. Fantastic. Okay. Well, shall we move to practice? Or what do you think, Megan?
Yeah, if there's no more questions, we can move on to the second half.
Okay. Lovely suggestions of what people are doing to take care of themselves, but I don't think.
Okay.
Yeah. Okay.
All right, we'll go ahead and move on. And like I said, we'll have another open question session at the end. There we go. All right, so as we start to talk about relaxation skills, the first thing I want to highlight, and this actually pigtails beautifully with kind of everything we were just talking about, is there is a distinction between activities that are relaxing and relaxation exercises. So relaxing activities are beneficial and helpful for maintaining good mental health, so definitely keep doing them without a doubt. Relaxation exercises differ because these techniques produce a distinct physiological state in our bodies that is the direct opposite of how our body responds to that stress response. And this process is actually called the relaxation response. So just as the stress response results in the arousal of many systems, the relaxation response calms these systems. It actually serves as our body's kind of natural restorative process. The short-term or immediate effects of the relaxation response include decreased heart rate, blood pressure, breathing rate, and muscle tension. But in the long term, research indicates that people who regularly practice relaxation skills and exercises that elicit this response report less symptoms of anxiety and depression, as well as a better ability to deal with stressors. So we'll be focused on 3 key relaxation techniques in this series: breathing, progressive muscle relaxation, and imagery. These techniques are all research-based. There's decades of studies that have been shown they're proven them effective in reducing stress and promoting relaxation. Our goal with this is really for you to have a range of techniques to use. We know that not every one of these techniques is going to be equally effective or appealing to every person in every situation. So we really want you to have the opportunity to determine what's going to be the best fit for you. All right, so although we're primarily focused on breathing to promote relaxation, its primary purpose is that vital role it plays in carrying oxygen and carbon dioxide in and out of our bodies. But how we breathe can impact this process. Chronic shallow breathing or breath holding when you're tense or anxious can disrupt this flow and actually make coping with stress more difficult. Learning to slow and pace your breathing can help quiet the mind and relax your body. Breathing techniques are one of the most effective ways of reducing stress. Research has indicated that breathing exercises are effective for treating panic, anxiety, and depression, as well as muscle tension, headaches, and fatigue. So having good breathing skills can actually enhance both your psychological and physical well-being. So we essentially breathe in one of 2 ways, either with our chest or with our abdomen. We all engage in abdominal breathing as infants. How can you tell if a baby's breathing? You see their stomach rise and fall. Most everyone ends up transitioning over to chest breathing by adulthood. Chest breathing utilizes the small muscle groups in your thorax to expand and contract the lungs. This type of breathing tends to increase with stress and become even more shallow and rapid. Several of the physical symptoms that people experience during the stress response, when it's kind of at its most intense, heart palpitations, dizziness, lightheadedness, are due to this particular type of breathing pattern. Abdominal breathing uses the diaphragm to expand and contract the lungs. The diaphragm is the large dome-shaped muscle that sits right underneath your lungs, and it separates the chest cavity from the abdominal cavity. When you inhale, that muscle contracts and flattens. Air is pulled down into your lungs, and the stomach rises as that abdominal wall expands. When you exhale, the diaphragm relaxes and returns to its dome shape. Air is pushed out of your lungs, and your stomach falls as that abdominal wall lowers. Breathing with your diaphragm allows more space for the lungs to expand, which provides a fuller and more complete breath than when breathing with your chest muscles. And most importantly for our purposes, abdominal breathing is the easiest way to elicit the relaxation response in your body. So before we jump into exercises, I just want to highlight one other little tip. Rating your stress level before and after practicing these skills can really help you make an informed decision about how effective these different skills are in reducing your stress. Tracking your stress levels over time can help you monitor how much your skills improve with practice. So we can just use a basic 0 to 10 scale, with 0 being no distress at all, totally relaxed, and 10 being your max level of distress. So for most people, the 10, you can feel that stress response to some degree. Rapid heart rate, tightness in chest, sweaty palms. It can be helpful to personalize your stress scale by thinking of a specific experience or activity that may be your 0 as well as your 10. So your personal 0 may be a relaxing hobby, a favorite vacation spot, a peaceful outdoor space that you enjoy. Your personal 10 may be the significant stress you experienced when undergoing a medical procedure or narrowly avoiding a car accident. The purpose of these personal anchors is simply to serve as reference points that allows you to best determine in a consistent manner where your stress falls on that 0 to 10 scale at any point in time. All right, so before we jump into directions, I just want to highlight a few things for folks to keep in mind, and this will apply to kind of everything we do going forward in subsequent sessions and your home practice. If at any point while doing any of these relaxation exercises you experience physical pain or discomfort, always feel free to stop. If my pacing of the breathing exercise is too fast or too slow, modify the pace to what works best for you. For individuals with conditions such as asthma or COPD, sometimes an extended inhale or an extended exhale may feel difficult. The overall goal with this exercise is simply slow, even breaths in and out. And finally, as you practice these exercises in the coming weeks, if you experience any type of kind of ongoing negative side effects, just please consider consulting a physician or healthcare provider. All right, so for our directions as we kind of get things set up, first is I'm going to ask that everybody either sit upright in a chair or lie flat on your back. Those tend to be the two bodily positions that are the most conducive to learning abdominal breathing. And also, once you're in position, if you can please just place a hand on your abdomen, kind of right at your waistband where a belt buckle would be. We typically request that you close your eyes during these exercises just to direct your attention inward and really focus on that breath. However, if that feels uncomfortable or you prefer not to, all I'd ask is that you please find a point on a wall or something in the room that you can focus your eyes on during this exercise. And this is just to minimize distractions. All right, so our ultimate goal with this exercise is slow, even-paced abdominal breathing. I'm going to ask you to inhale through your nose to a count of 4, pause, and exhale through your mouth to a count of 4. You should be able to feel your stomach rise on the inhales and feel your stomach drop on the exhales. If it feels difficult to kind of track that sensation, just feel free to open your eyes and focus on your hand. You just want to see it rise as you breathe in and lower as you breathe out. All right, we're going to do this breathing exercise for about 3 to 4 minutes. Since this is our first technique, I'm going to start out with something really brief, but I do want everybody just to get a sense of this type of breathing and how your body responds to it. Okay, so if everybody is in position, I'm going to get in position too, and has a hand on their abdomen. So first I'm going to ask if you please check in really quickly on that stress scale and where is your current stress from a 0 to 10. Okay, and I'll ask you just please to go ahead and close your eyes and we'll begin. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Last breath. Breathe in, 2, 3, 4, pause. Exhale, 2, 3, 4. Okay, and if you would like to open your eyes. All right, so good, great job, everybody, for who wanted to participate and was able to do that. I am going to just start with kind of checking in on how that went for you, just in terms of how you're feeling now compared to how you felt when it started. And as always, just like before, we can now open it up for questions for kind of the remainder of the hour. Definitely we can start with questions about the technique or people's reactions to the technique and then kind of go from there.
Going to give people just a couple more seconds to reply. We've heard from more than half the group.
Great.
Okay, I'm going to close the polling.
Okay, excellent. Okay, so it looks like for the most part, folks felt at least somewhat more relaxed with this. And we had a handful of folks where maybe they felt a bit more stressed or didn't notice any significant change. And we can chat about that also. All right, thank you everybody for completing this. Let me just start with a couple things about this and about these results specifically. So a few things to keep in mind is that for a lot of individuals who maybe struggle with anxiety or stress or have been under a lot of stress for a while, your body it may take your body a while to become familiar with being relaxed again. So it may not be that easy just to fall into relaxation that quickly. And we do see that sometimes happen, especially for folks who maybe struggle with significant anxiety. When they actually start doing relaxation techniques, they'll notice that their anxiety actually peaks while they're doing the exercise. And again, we've got to remember that stress response. When the brain detects something unfamiliar, uncomfortable, it reads that as danger and kicks off that series of changes. And that's what we see happen for a lot of people who simply experience enough stress that they feel stressed often enough. When they actually do start to relax, their body's not familiar with it, and the brain kind of sends out that signal that something must be wrong. So that can sometimes play into why folks, when they start these exercises, may not notice not only not being relaxed right away, but they may notice their stress level increasing a bit. These exercises, even though it's a basic breathing exercises, these do take a while to really master and to be able to benefit from. So for anybody who maybe didn't get quite the result that they were hoping for, just please keep that in mind. My pace may have been off for you, which is entirely possible. I was either counting too slowly or too fast. So trying this at your own pace, you may get more benefit from. We did only do a 3.5-minute exercise. Usually we try, with most practice, try to shoot for around between 5 to 10 minutes, anywhere up to 20 minutes. So we were definitely on the lower end of things just for the sake of time in our initial practice attempt. So I just wanted to offer those a few things to keep in mind for folks where the results may not have been quite what you had hoped. For those that have noticed that they're feeling a lot more relaxed, that's excellent. I'm glad you felt like even with that brief exercise, you could feel a little bit of shift in those suds. The biggest thing I can say about these relaxation skills is, like any other skill, they require practice. You're asking your body to breathe in a very different way than it normally breathes. So it actually takes some level of kind of training your body to become efficient and comfortable with this type of breathing. So please keep that in mind also. We often see the benefits and the effects of this drastically increase with regular practice over time.
So we do have some questions coming in from
Absolutely.
the audience about technique or responses beyond just that many people found it relaxing. So I feel like you addressed this a little bit in terms of the pacing, but it sounds like Veronica was breathing along with her mom, and her mom, it sounded like the body had a desire to do a longer count than 4.
Oh,
so
absolutely.
Extending to whatever is natural to the person is fine.
Absolutely. I started with 4 in part to keep it just brief, not knowing who all would be on the call or comorbid medical issues or things like that. So I started us on a little bit briefer count. Most of relaxation and breathing techniques usually range anywhere from a count of 4 up to about 8 or 10. So that's one thing I would encourage you, as you're finding your own pacing that works for you. If you nail that 4 and you feel like you could go further and extend that inhale and exhale longer, certainly feel free to kind of ramp it up and work with what's going to work well for you. Most people with practice are probably going to find that they can extend beyond a count of 4 and probably achieve even maybe a little deeper level of relaxation.
Nice. So Susan, I loved this comment because I feel it. She said, I get stressed that I'm not doing it right. And she's finding that her abdomen goes in the opposite direction than what you were saying, that she's, I guess her belly's expanding on the exhale. Do you have any tips for training that for the results?
So sometimes with the abdominal breathing, what happens a lot is, first of all, when you first start it, it may not always come naturally, and you may have to be almost manually kind of extending that abdominal wall yourself and pulling that abdominal wall back in when you exhale. So sometimes at the start of this, if it's not coming naturally for you, you can do it essentially, I guess, manually, in terms of kind of forcefully expanding that diaphragm, lowering that diaphragm and expanding that abdominal while on your own, again, just until you kind of get the pacing with it. A lot of times what happens is even when people start breathing with using the diaphragm and abdominal breathing, they resort back to chest breathing because that's just how most of us breathe all of the time. And our body just goes back to what's familiar. That's our habitual way of breathing. So keep that in mind too. You may have noticed that even if it started out, it may shift back. So it can be worth checking in on that from time to time.
Great. I'm going to take a question from Angela in the chat before calling on Angela that we have co-hosting. Angela was noticing that her left side gets tense when doing breathing exercises. And just wondering if you had any thoughts about why that might be.
Well, I mean, the thing is, like we said, since we are breathing with your diaphragm and you're actually expanding those lungs in a way that you don't normally expand them, sometimes these exercises can get people in touch with place where they may be holding tension and may have muscle tension that they weren't necessarily familiar with the usual chest breathing. So that would just be one thing I would consider. Like I said, I think the biggest thing with these, and this is where it's hard to kind of keep things so general, given we have such a big group, is that if it does become a kind of consistent level of discomfort or kind of negative side effect that you do notice while you're doing this, it could be worth checking in with a physician or a healthcare provider. The other option is, and this is one of the reasons we'll be teaching a range of techniques, is for some people, they just find that the other techniques work better for them and they may be more comfortable with those and they may relax better with those. So kind of hang in there with that piece also, because we are going to be offering some other techniques that while they'll utilize breathing, it won't be utilizing it to this degree.
Great, thank you, Megan. And it looks like our other participant, Megan, and I have the same kind of question. She says that she often gets questions from her patients on how we can keep our minds from wandering during the exercise. And I felt that same way. I started off thinking, I'm on a beach, I'm going to do this exercise. And then in about 15 seconds or so, I'm thinking about my kids' homework and I'm thinking about, this other meeting that I might have to do later this afternoon. All these things, while I'm still breathing, I'm letting my mind wander. So she and I are wondering if you have any tips for helping us to stay on track with our thoughts during the exercise.
Yeah, so we call that mind chatter, and that is one of the most common obstacles that people run into when doing breathing techniques or relaxation techniques, as well as things revolving around like mindfulness and meditation. So first and foremost, that's very normal. Almost everyone experiences it. I experienced even while I was counting out the exercise for y'all. So it happens to almost everyone. The best thing you can do is, instead of trying to get kind of wrapped up in those thoughts, try to just kind of let them go and just return your focus to that breath. Again, that's one of the reasons we kind of try to have folks consider closing their eyes, just anything that can really turn that attention inward. But that's the best thing. The thoughts are going to pop up. I think it's very rare for anybody to do these exercises where they don't have kind of intrusive thoughts about other issues or matters popping in from time to time. The best thing is just to seek to not get too caught up in them, not beat yourself up for them, and just try to return that focus back to your breath as much as possible.
Great, thank you. Those are very helpful tips. I think we had another question about sharing the scripts. If you had scripts that would be helpful for people to do this exercise.
Oh, so for I did not have a specific script for it. I was going to offer, though, for folks who feel like having like kind of the guided exercise is helpful to kind of get you started, was to feel free to go ahead and utilize this portion of the recording once the video is uploaded on YouTube, because you could easily just fast forward to this piece and then you would have me kind of guiding you through it if that type of guided exercise could be useful for getting you started. As far as scripts, I mean, there are, honestly, even if you just do a basic Google search on like abdominal breathing or diaphragmatic breathing, I think like Mayo Clinic, maybe Cleveland Clinic, there are some different sites that will talk about this, and they may give you a couple examples of just different types of breathing techniques you can do that revolve around different counts. Some may have a shorter inhale and a longer exhale. Some may have a longer pause in the middle. The truth is with this, for abdominal breathing, the biggest key is just sort of trying to slow down your breathing and keep it evenly paced. That's really our goal with this in terms of trying to promote relaxation. One tip I will give, though, that is just useful to keep in mind, if you're somebody that at times struggles with really acute anxiety, where it kind of feels almost panicky and overwhelming, one really easy breathing technique to do, which just alters this a tiny bit, is just take a normal breath in through your nose, don't extend it, and do a long, slow exhale through your mouth. So normal breath in, long, slow exhale out. That's called calm breathing. And that's one of the ways to really kind of cut off really acute anxiety as quickly as possible.
Great, thank you. I just want to acknowledge and say I appreciate Brian's comment in the chat about, Eastern medicine versus Western approaches, and just this, idea that the mind-body connection really is a powerful medicine all on its own, and it can help us heal in ways that a lot of us don't really tap into.
Absolutely. No, it's an excellent point.
And then maybe another question before we move on our comment. It looks like Courtney is trying to think of a space to lie down and do this with students when they're back in person, maybe next fall. And Megan, I know you probably have taught this technique with students before, and wondering if you have any tips for how to do this in a classroom.
So I've definitely taught relaxation training classes before. I typically have done them seated as opposed to folks lying down, but you could do that. I think the biggest thing is just to encourage folks, especially, and depending on how big your group is, you may have more of the ability for people to check in and kind of individualize this based on people's specific experiences. I think the biggest thing is to just really encourage folks that, everybody does kind of respond to this differently. While we know at a physiological level, we know what this is doing in our bodies, at kind of emotional cognitive level, people can respond to this really differently. There can be a range of responses, and that's okay. Part of it is there truly is a practice effect with breathing, which sometimes seems very counterintuitive because people think I breathe all day long in and out. How can this really be used to help me to actively reduce stress? But like I said, you really are asking people to breathe in a very different way than they normally breathe. And that absolutely can require a level of practice in order to become really proficient in it.
Great. Megan, thank you so much. We are actually nearly at the hour. You know this how often this happens so quickly.
I know.
So in wrapping us up, there's a couple of sort of looking forward questions quickly that
I'm just going to the slide. There we go. I just wanted to pop up the last slide just for folks to be aware of, just with some general guidelines for practicing this over the next week. When you're just starting out, we normally recommend just try to practice once or twice a day for anywhere between 5 and 10 minutes. Certainly feel free to extend those counts if that feels comfortable for you. Or like I said, as you become more proficient with the 4 count and want to expand it a bit more, feel free. And if you can extend the time, maybe not necessarily in the coming week, but in the weeks to come, always feel to ramp up that time up to about 20 minutes of breathing if you could. The longer you extend those counts and the longer that you engage in this activity, the more you're going to be slowing down your breathing rate and the more it's going to counteract that kind of chronic physiological arousal. Okay, sorry, Janet, go ahead.
No, that's it. You exactly, that was the first thing I was going to say. We talked about the importance of practicing. What practice did we want to ask for from people that need to make this more than just an illuminating hour, but a tool that they're taking forward? And a question had come up in chat about availability of slides, even actually somebody asking to preview the next session. I know we're still refining what works and what doesn't in this format, so we're not ready to release future, but I want to share a link with everybody where we share open classroom resources. So for example, Megan's references, we're going to be posting there, and the link to this program as well as will be there as well as on YouTube. So with that, Megan, we are at time. Is there any final thought that you want to offer to the group before we close out?
Just as always, I so appreciate your interest in this topic and your willingness to invest an hour with us to kind of learn some of these strategies. I certainly hope it was helpful. I certainly hope if you are interested in it, you'll be able to get it some practice. And like I said, we'll pick up again next Thursday for anyone who can attend. And just to kind of let folks know going forward with the relaxation exercises, we are going to be doing more advanced exercises each week in the sense of we're going to incorporate other strategies beyond just breathing. Next week will be muscle relaxation. We're also going to be extending the exercises so they get a little bit longer each week as you build up your relaxation skills. So kind of keep that in mind as well going forward in terms of what to expect.
Perfect. Well, Megan, thank you so much for this. There's been so much praise, so many people in the chat saying that they feel more relaxed or that this is a practice that they intend to incorporate. So we certainly appreciate you sharing your time and your expertise with us. Angela, thank you for co-hosting with me. Thank you to the Masters of Public Health program for co-sponsoring this portion of our series. And to our audience, thank you for participating, the generous ideas that you offered each other about self-care. And we will hope to see you back at a future Open Classroom program, possibly the next one in this series on next Thursday. So take care, everybody. Please stay safe out there.
Thank you so much, everyone. We hope to see you next week.
Bye.